Welcome to Smart Healthcare Analytics Solution from SNP Technologies. Built on Microsoft Cloud technology, SNP's Smart Healthcare Analytics Solution is used by healthcare providers who want data-driven analysis to guide and support important decisions that impact patient care coordination and revenue. Our Smart User Story demonstration explores how St. Anthony's Healthcare, a clinically integrated network, harnesses SNP's Smart Healthcare Analytics Solution to mitigate patient leakage. Patient leakage is when patients are referred to healthcare providers outside the clinically integrated networks. Some leakage is inevitable, but clinically integrated networks need to mitigate its scope by doing so its impact on care coordination and revenue. Our story begins with Stephen Smith, the CFO at St. Anthony's Healthcare. As the CFO, Stephen is responsible for enlisting SNP's Smart Healthcare Analytics Solution as a tool to analyze claim data for factors that impact fiscal performance. Stephen begins by launching SNP's Smart Healthcare Analytics Solutions Leakage Dashboard. Here, he gets an at-a-glance view of key leakage metrics for the 2016 calendar year. He sees a total leakage of $1.68 million. That is claim revenue contributed to out-of-network providers. Additional top 10 KPIs show how patient location, patient diagnosis group, and services rendered impact leakage in terms of revenue. Here, for instance, Stephen sees that 10 CPT codes for services rendered by out-of-network providers have combined revenue of just over $900,000. Stephen can adjust the filter period to see how the metrics change over time. Lastly, the patient leakage and related revenue report provides another high-level overview of leakage in a graphic that combines monthly patient leakage and related revenue in a single report. SNP's Smart Healthcare Analytics prediction reports chart the trend for the KPIs and use a prediction model to forecast leakage projections. Stephen sees an upswing in leakage projected for St. Anthony's Healthcare and calls a meeting with Director Operations Phil Romano and Clinical Director Dr. Kristen Miller. Phil and Kristen are directed to use SNP's Smart Healthcare Analytics Patterns Report to gain insight into the possible causes for the leakage. On this report, they can visualize how 3 variables correspond to leakage, namely patient city of residence, service providers, and CPT codes. Each report shows the top 10 values relative to leakage and shows patterns that suggest reasons for the leakage. Each report is interactive. Phil and Kristen can click on data points in any of the 3 reports to filter all reports by that data point. For instance, they see that the city of Fairfield has the highest leakage. They click on Fairfield to filter the other 2 reports to show the top 10 values where the patient's city of residence is Fairfield. As a result, Phil plans to discuss potential reasons for out-of-network referrals with the top providers of service to these patients from Fairfield. For her part, Kristen researches further on CPT codes of these patients from Fairfield to determine why their groups refer the related patients out-of-network. You have just seen how SNP's Smart Healthcare Analytics Solutions helps clinically integrated networks make informed decisions to mitigate leakage for improved patient care and revenue optimization. For more information, please contact SNP Technologies or your Microsoft representative, or visit our website www.snp.com.